Coronavirus, how to protect yourself. How coronavirus, COVID-19, spreads. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Can someone spread the virus without being sick? People are thought to be most contagious when they are most symptomatic. Some spread might be possible before people show symptoms. There have been reports of this occurring with this new coronavirus. But this is not thought to be the main way the virus spreads. Spread from contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. How easily a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily, like measles, while other viruses do not spread as easily. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community in some affected geographic areas. What are the symptoms of COVID-19? Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease 2019 COVID-19 cases. The following symptoms may appear 2 to 14 days after exposure: fever, cough, shortness of breath. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. If you think you have been exposed to COVID-19 and develop a fever and symptoms, such as cough or difficulty breathing, call your healthcare provider for medical advice. How to protect yourself. There is currently no vaccine to prevent coronavirus disease 2019 COVID-19. China is presently testing the first set of vaccines as of March 19, 2020. The best way to prevent illness is to avoid being exposed to this virus. Take steps to protect yourself. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at high risk of getting very sick. Take steps to protect others. Stay home if you are sick, except to get medical care. Learn what to do if you are sick. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Wear a face mask if you are sick. If you are sick, you should wear a face mask when you are around other people and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example, because it causes trouble breathing, then you should do your best to cover your coughs and sneezes, and people who are caring for you should wear a face mask if they enter your room. If you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick, and they are not able to wear a face mask. Face masks may be in short supply and they should be saved for caregivers. Learn what to do if you are sick. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. To disinfect, most common EPA-registered household disinfectants will work. Use disinfectants appropriate for the surface. Options include diluting your household bleach. To make a bleach solution, mix 5 tablespoons 1/3 road cup bleach per gallon of water. Or 4 teaspoons bleach per quart of water. Follow manufacturer's instructions for application and proper ventilation. Check to ensure the product is not past its expiration date. Never mix household bleach with ammonia or any other cleanser. Unexpired household bleach will be effective against coronaviruses when properly diluted. Alcohol solutions. Ensure solution has at least 70% alcohol. Other common EPA-registered household disinfectants. Products with EPA-approved emerging viral pathogens are expected to be effective against COVID-19 based on data for harder-to-kill viruses. Steps to help prevent the spread of COVID-19 if you are sick. Follow the steps below. If you are sick with COVID-19 or think you might have it, follow the steps below to help protect other people in your home and community. Stay home except to get medical care. Stay home. People who are mildly ill with COVID-19 are able to recover at home. Do not leave, except to get medical care. Do not visit public areas. Stay in touch with your doctor. Be sure to get care if you feel worse or you think it is an emergency. Avoid using public transportation, ride-sharing, or taxis. Separate yourself from other people in your home. This is known as home isolation. As much as possible, you should stay in a specific sick room and away from other people in your home. Use a separate bathroom, if available. You should restrict contact with pets and other animals, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people with the virus limit contact with animals, until more information is known. When possible, have another member of your household care for your animals, while you are sick with COVID-19. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with them. Avoid sharing personal household items. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. Wash thoroughly after use. After using these items, wash them thoroughly with soap and water or put in the dishwasher. Help others by sharing this video on your social media. Be strong and supportive during this time. This will surely pass.